Okay, hey everyone. I am live and I am really excited. Today we're going to be talking about, give me just a second, let's get Dr. here. Hey, okay, hi. It's 11:54. We're waiting for, hi, you're on, that was quick.
Okay, well, I just keep pushing buttons until something works.
I saw you tried calling. Okay, thank you so much. I'm going to ask you to introduce yourself in just a minute. But hi, everyone who's on. Hi, everyone who's going to be watching this later. We are on with Dr. Clarke, and we're going to be talking all about the mind-body connection and the different ways that our body holds pain. Dr. Clarke, I wonder if you want to hop on and just kind of tell us a little bit about who you are. Um,
Let's see, am I on?
Yeah, you're on. You're fully on. We see you.
Wonderful. Yeah, well, I'm Dave Clarke. I'm a gastroenterologist of all things, and actually started out in life as a New Yorker, East Flatbush, Staten Island for a few years, but currently in Portland, Oregon, where I practiced for 25 years. Started with a patient whom two universities could not diagnose, very seriously ill 37-year-old woman, and accidentally stumbled on the fact that she had been experiencing a severe amount of stress starting when she was a girl, and didn't know what to do with that, had no training. You know, here I was in my 8th year of formal education and training and had no idea what to do with that information about childhood stress. But I knew of a psychiatrist named Harriet Kaplan, who was at UCLA where I was in training, who had an interest in these things. And so I hooked the two of them up and never thought about it again. I had no idea that the psychiatrist could possibly do anything with this very ill woman. But I ran into Harriet in an elevator 3 months later, and just to make conversation, asked her how the patient was doing, and the patient was cured. Had no further symptoms, had stopped taking 4 different medications she was using, and that just shocked me that you could alleviate a serious physical symptom just by talking to somebody. So I prevailed on Harriet to teach me how she did that, you know, thinking I might see a few patients a year with those kinds of issues. And that all I would have to do was just, you know, find that these psychological stresses were going on in somebody, and then I could send them off to a local mental health professional who would take care of the problem. And I was wrong big time on both counts. First of all, it wasn't a few patients a year, it was 5 or 6 a week. It ended up being over 7,000 over the course of the last 38 years that I've been doing this. And there weren't any Harriet Kaplans in Portland, Oregon when I got up here to start my private practice. And a lot of those patients, even after going to mental health practitioners who were usually not familiar or comfortable with people who were physically ill, and they didn't know what to look for, a lot of those patients came back and said, I'm not better, now what do we do? And so I had to learn, you know, using Harriet's framework, but a lot of trial and error, a lot of, you know, interviews in detail, trying to understand why these people were ill and what could possibly help them get better. But even as a beginner, I was helping people. You know, people were making progress that they weren't making in the rest of the healthcare system. So that encouraged me to keep going.
I'm curious about, first of all, I just want to say, like, I'm really grateful. I emailed Dr. Clarke. I had written a blog, and then I want to reference some of the things you're mentioning. I had written a blog like a couple of years ago, and I had quoted yourself, Dr. Clarke, and also Sarno, just 2 names, 2 books that I had read all about, like, how the body holds stress, because I had some really bad somatic symptoms. And so I'm really grateful that you're on. I just want to thank you for your time and really humbled by your wisdom. I am really curious, you know, I sent some questions to ask you, and I also wonder if we can talk a little bit more about it. I'm curious about what was the ways, like, what did you see when people came into the office, right? You said, like, there's sometimes even the mental health world, people were uncomfortable with some of the symptoms, maybe because they don't have experience, but, like, what were the questions or what was the construct that Dr. Harriet taught you that you kind of approached these clients with that helped you get to know them? Because right with that client, it sounds like an incredible story where she was healed, and it was almost like these pieces that started clicking into place. For obviously some people it takes a little longer, or their healing's a little different, but it sounds like the depathologizing or getting to the crux of the issue was tremendous. I'm curious about the framework of when you met with clients, like if you're comfortable sharing.
Oh, absolutely. Yeah, it's what I call a stress evaluation. My first book called "They Can't Find Anything Wrong" kind of goes through it chapter by chapter, but it's fairly straightforward. It's nothing that people like yourself wouldn't be doing. It starts with just getting the chronology of the illness. When and where did the symptoms begin? Because oftentimes there's a stressful event that happened in a person's life right before the symptoms were triggered. Not always, but oftentimes. And then the progress over time, because oftentimes you can find chronological links between when and where a person was having flares of symptoms and when and where they were having stresses in their life. So that's the first step. The next is very simple. Just, what's going on in your life right now? What kinds of stresses are you coping with? What's creating difficulties for you? And that could be, almost anything. I've probably seen it cause symptoms in one person or another. I mean, one of my patients, his church was splitting in two. They had a doctrinal dispute and they were going their separate ways, and he was a deacon of the church, and it was just tearing him up. But none of the other doctors who'd evaluated him just, asked him about his life. So they completely missed the fact that this church breakup exactly coincided with the time he was having his symptoms. So then the next part is, there's a subset of the stress in your life right now, which is that a lot of my patients are the kinds of people that they take care of everybody else in their world, but they don't know how to put themselves on the list of people they take care of. So these are kinds of folks, if they've got 5 or 10 minutes of free time, they're thinking about what useful, constructive thing they can do on behalf of somebody else. And they never put themselves on that list of people they care for. And sooner or later, you can't stay on that treadmill forever, and the body protests. But the biggest shock of my medical education was finding out that stress when you were a child could make you ill as an adult. And that, sometimes it was, very obvious, sexual abuse. That very first patient I mentioned was sexually abused repeatedly for 8 years. But other times it's not so obvious. It can be more subtle, like people who are just made to feel like nothing they ever do is good enough. And they gradually develop a very poor self-esteem. They become extremely self-critical, and that just becomes a habit. It becomes an assumption that they are somebody who doesn't measure up. And that weighs on a person, creates a huge amount of stress. So searching for those childhood experiences, some obvious, some not so obvious, became a big part of my evaluation. And then the last parts of the evaluation are very straightforward. It's just looking for depression, PTSD, post-traumatic stress disorder, and anxiety disorders, because it turns out that if you take the whole universe of people with those conditions, the majority of them present themselves to the healthcare system with a physical symptom, rather than a mental health symptom. I mean, you're, as a mental health professional, are accustomed to people who have those conditions, but they know they have those conditions and they come to see you specifically for help for those issues. But if you take everybody with those illnesses, most of those people end up with a physical symptom, show up to the doctor, and even with depression, most of them will say, no, I don't really feel depressed. I've got this symptom. I really need you to help me with this symptom. I'm really actually desperate for you to help me with this symptom. I'm a little stressed. I'm frustrated. I'm exasperated, but no, I don't really feel depressed. But when you go into more detail about other symptoms of depression, sleep issues, energy issues, appetite issues, losing interest in activities they used to love to do, then the depression diagnosis becomes more obvious. So that's my process. And by going through those step by step, I can almost always come up with one or more issues that are linked to the patient's physical symptoms.
Yeah, thank you for sharing. As I'm listening to you, I think one of the pieces that I was reading the research on was just like for some clients, and kind of what you're talking about, like even in terms of the stress evaluation, and sometimes something doesn't sound so fancy, but it is fancy, so to speak, for bringing a new light or perspective to what's going on. And I imagine, I know for my own self, like I mentioned yesterday when I was just posting about this, like I had a lot of gastro issues when I was younger. And, you know, I remember going to one gastro and getting all different procedures. And then I was going to like health food stores to help me like digestive system. And it took me so long. And I was like a pretty knowledgeable person. And even as a young therapist, like over a decade ago, it took me a while to actually start linking up the pieces. And I was connected to good people. So I wonder if part of the experience for clients in your care, and I know I asked you this question when we spoke briefly yesterday, is that there's this normalization of like, you're not crazy. Because I know in our practice, the reason a lot of times people me or like some of the things I've written about is like the normalization of the way that the body speaks. So even if there are medical symptoms, right, or if like even if the person does have a medical condition and also somatic symptoms, or maybe not medical, they have very strong psychosomatic symptoms, meaning that there isn't something structurally wrong internally. There's like nonverbal communication, and I imagine your clients, your patients will felt that of like, you're not crazy, not thinking that you're like a loony and going to give you a prescription or tell you that it's all in your head. I feel like that's half of the healing of like, you get it when the whole world doesn't, or the whole world thinks I'm nuts, or I think I'm nuts.
Yeah, you're absolutely right. And the healthcare system, unfortunately, gives patients that message that when there's no organ disease or structural abnormality that the doctor can find, their training is that their job is done. They don't need to go any further. There's no possible way to diagnose a patient like that more accurately. And the patients get the message either, usually not overtly and verbally, but they get the message that this is all in your head. You're going to have to live with it. Go away and don't bother me anymore. When in fact, if you know what to look for, you can diagnose people with this condition just as accurately as you can anybody else. And you can achieve therapeutic outcomes that are in fact better than we get with most people with diabetes, cancer, and heart disease. But it all comes down to, number one, knowing that there's more to do with a patient like that, more to investigate, and knowing then what to look for, what to investigate, just in the stress evaluation that I just described. And absolutely normalizing for people that the brain is fully capable of causing physical symptoms every bit as severe and often more numerous than you get with organ diseases or structural abnormalities. I mean, I've had many, many patients in the hospital. One patient I tell the story about, a 17-year-old girl. I was consulted on her 70th day in the hospital. She had seen 6 other gastroenterologists over the previous 18 months. She was getting morphine around the clock in doses that are usually given to people with late stage cancer. I mean, and all of this was entirely stress related. By uncovering the issue in her case, she was off of the morphine in a week. She was off of all narcotics in a month. Again, all just by knowing what to look for. So yeah, these are absolutely just as real and severe. The brain is capable of doing this. Many people are aware of phantom limb pain, where somebody has pain at the location of an amputated limb. The limb is no longer there, but they feel pain in that location. The only place that pain is coming from is the brain, because the limb is not there anymore. But the brain can generate huge amounts of symptoms. So it's important to recognize that when you have pain somewhere, yeah, it could be coming from that part of your body where you're feeling it. But if the doctor doesn't find any explanation at that location, you got to think about the brain generating that pain, which means thinking about the stresses that are doing that to your brain. And if once you get that thought process, you're on the pathway toward the correct diagnosis.
Yeah. And I love that you mentioned the phantom limb pain, where basically, do you want to talk a little bit about what that is? Because I think it speaks to like the neuropsychological components that a lot of people kind of like brushed over, but it's actually fact. You want to explain just a little bit about it?
Yeah, you bet. I mean, it's common in people who've had to have an arm or a leg removed, and then they still feel pain in the place where the leg or arm used to be. And obviously, the pain is not coming from that missing limb. It's generated by the brain. There's a more fun example of this from a picture that was published in the British Medical Journal in the mid 90s. of a construction worker that he was at a site, job site. He jumped down from somewhere, and suddenly a nail penetrated through the bottom of his boot with the sharp point sticking straight up off the top part of his boot. And he was instantly in agonizing pain. He was rushed to the emergency room. He was given morphine intravenously to alleviate the pain. And then they carefully cut the boot away, only to find that the nail had gone neatly between his toes and hadn't caused any damage to his body at all. But he had nevertheless experienced this horrible pain seeing the nail sticking up out of his boot. And it was, all generated by the brain, but absolutely real. I mean, there's, pain is felt in the brain. Pain can be generated by the brain. And we
Yeah.
need to be aware of that as clinicians.
So basically, just using that, I love that example that you're giving. Just using that example is that the fact that he was in pain, right? The fact that he came in pain, he wasn't making it up, right?
No.
What happened is that his brain processed the information as danger, sharp, terrifying object. It's causing me pain, and the brain reacted to the pain being there. So if somebody met him in the emergency room and judged him, then he would have felt crazy versus like, oh my goodness, the brain's having that reaction, right? That's flooding the brain, which is normal, and it's actually causing like a logical response in the brain. I just want to define it for people because I
You
think
bet.
okay.
That's exactly it. Yeah, that it's perfectly real pain. It's brain generated, and the reason the brain does this to our bodies is because there's fear or anger or trauma or repressed emotions that are not recognized. All kinds of things. The advent of the functional MRI machine has shown us that many people with what we call functional syndromes like irritable bowel or fibromyalgia, their brains are anatomically different than people who don't have those conditions. So there's a real physiologic basis to this. That's why the nonprofit that I run is called the Psychophysiologic Disorders Association. It's a blend of psychology and physiology, but it absolutely is not imaginary.
Can you talk a little bit? So the reason I wanted to pause on that point and just like the phantom limb syndrome is kind of like to anyone who either isn't knowledgeable or to anyone who gets frustrated with people who are not quote unquote in the box, even though part of the boxy way of thinking, if we brought it in the way that we understand things, it could feel so incredibly validating. People could end up feeling like gaslit, right? Or they could feel like their mind is being played, or they learn to stop trusting their body, or people around them start telling them that they are so dramatic when essentially there's something very real happening. I wonder if you could tell us a little bit about your nonprofit that you run a little bit. I checked out the website. Could you share a little bit about, the website, the goal?
Yeah, the Psychophysiologic Disorders Association, the website is ppdassociation.org, and we've got a lot of resources on there. It's not scientifically backed books. We got a website, a webinar-based course. It's for professionals, but people who are not professionals can take it as well. Lots of videos, lots of text information. It got started over 10 years ago. A group of us who were doing this work more or less in isolation around the country came together at a conference in Ann Arbor in 2009. And we realized that even though we had been working in isolation and we came from different professional backgrounds, different personal experiences, different kinds of patients and clients that we worked with, we had all reached very similar conclusions. I mean, the same ideas that I'm sharing with you here, other people had reached those same ideas independently, working on their own. And we realized we needed to get the message out to other healthcare professionals. So we formed the nonprofit. We incorporated in 2011. We hired our executive director in 2018. And we've been putting on conferences, sponsoring research, writing the textbook, establishing the online webinar training course. We're having another big conference at the end of October. We've got 22 different speakers over 3 days coming in a virtual conference. These are international experts that are going to be presenting on all different aspects of this condition. So lots going on.
Okay. Awesome. And I wonder if you could talk for a minute about, because I know that I know that a lot of people or people's families or friends have a certain level of skepticism or criticism, and it could be their own denial that they're blocking against, right? And believing all of this, right? Sometimes, like we work with clients, and it's like there is this dissociated memory, or there is this pain. You know, you spoke about just before, like people who come in with a lot of pain. Lots of times there's a level of stress, or there's a level of like, well, you know, where do I actually place myself, or the person who always like gives to other people. And it's interesting because sometimes I tell clients, I want to help you get in touch with your anger, and they look at me like I fell off the moon, and they're like, you want to help me be an angry person? And I'm like, no, I don't want to help you be an angry person, but I want to help you be able to own, you know, all of the emotions. And a lot of the times what I see is that people repress their anger, and anger could just even mean like an anger when somebody says, can you do this? Can you do this? The anger bubbles up in their body. They don't share it. They shove it down. They start having physical symptoms versus saying like, I'm angry that you're asking more than I can give. The answer is no, right? You don't have to become an angry person, but kind of what you speak about, negative emotions, right? Who defines, you know, positive or negative emotions, but being able to more comfortably, actively get to know those emotions and giving yourself permission or learning the ways to be a human being in a way that's healthy. So that for sure is a thing. And I love the science. So I'm like, well, I don't love it because it makes me sad and I wish no children go through stress. But there is a huge piece where people who go through pain, stress, trauma, neglect, um, chaos when they're children, later on, their bodies develop symptoms. And I love that you said that because so many times people will reach out or will be like, but everything's fine, or my life's amazing. And then it's like, could it be from the past? Like, why would something from the past be kicked up, you know? And so many times it's like, you know, obviously the same way dissociated memory works, or the same way, like, lots of times we survive and we function. And when we're a little older, or if there's a trigger, when we're raising our own kids, or when something new comes up, or we're in a transition, or we're healthy enough to heal, the symptoms pop up. And so just like normalizing that, I think is like incredibly helpful. The piece I wanted to ask you about was the book that you shared with me. I have it in my cart. I was looking at it online and I'm ordering it for my staff, but the more sciencey book. And the reason I wanted you to talk about the sciencey book is because I mean, there's books by, you know, a lot of the somatic practitioners like Peter Levine and Pat Ogden, and Kolk. But I wonder if you could talk a little bit, because I know from the medical perspective, and you've worked with people like physiological components, if you could talk a little bit about that sciencey book, because I think for some people on here, or for some of their families, I think it would be really helpful for them to know about it so they see the science behind it.
Yeah, you bet. There really wasn't a textbook in this field. There were a lot of books written by individuals, most of them for patients, but we wanted one that would teach uh, all kinds of healthcare professionals, physicians, physician assistants, nurse practitioners, and also mental health professionals. And so we gathered a group of 16 different professionals from, you know, a full range of specialties, and asked them to write chapters addressing the whole, you know, diagnostic and therapeutic process. And it took, you know, 4 years, frankly, to pull it all together. But the result has been very good. And we edited it in such a way that it minimizes the jargon, so that the mental health professionals can read the chapters written by the medical folks and vice versa, and not get, you know, lost in a bunch of technical words. And the nice side effect of that is that people who are not healthcare or mental health professionals can read it as well. If you're a, you know, a science-oriented reader, and you like, you're not, you know, scared by a little bit of technical knowledge, then, and lots of therapists that I know are now starting to prescribe this book for their science-oriented patients, and it's working for them. So I was very glad to hear that it's going to have a wider audience. But I like what you said before about
Wait, what's the name of the book again? Just
oh, psychophysiologic disorders. And again, it's we came up with that name after a couple of months of debating among ourselves, because there's about 15 different synonyms for this, but it's a blend of psychology and physiology. And we like that term because it emphasizes to the medical community that this is a physiologic process. This is not purely a psychological process. This is not imaginary. You know, this is, you know, real physiology going on here, and therefore it's absolutely within what they should consider to be their job description. And you know, when physicians learn how to do this, it absolutely transforms their practice. I've given trainings, you know, all over the country, all over Europe, up in Canada, and when people learn this, you take a large group of patients. This is 40% of an average primary care practice, who are very frustrating to the point of inducing burnout in primary care clinicians, and you transform them into a very rewarding group because you see people get better. I mean, the first story in my other book was about a woman who was hospitalized at a major West Coast university 60 times in 15 years. She was cured with a 1-hour conversation. You know, it's very rewarding to be able to do that. And just by talking to somebody. Now, you know, I can't claim to get results like.
You have to define cured, or else everyone's going to be knocking down your door. What does that mean, cured?
She stopped having symptoms. She was having attacks of nausea, vomiting, and extreme dizziness 6 to 10 times a year. And she lived in the where there was a major university hospital, and she saw a dozen of their specialists and a psychiatrist who, unfortunately, like a lot of mental health professionals, didn't know what to look for when he was confronted by somebody who was physically ill, and he missed it completely. In fact, when she wound up in Portland, she was passing through town. She had one of her attacks. She was admitted to my hospital. And when I went to see her, she said, "Don't waste your time. You know, I've already had every conceivable diagnostic test. They're always normal. I've seen a dozen specialists. You know, go on and see your other patients." And I said, "Well, you know, I can't resist a challenge like that." So I sat down and had her tell me the story. And you know, I was still a beginner. This was 1987. But I knew what to look for, and in her case, fortunately, it was pretty obvious what was going on. And as soon as I was able to connect her, you know, it turned out that her attacks were all linked to encounters with her abusive mom. Mom was emotionally and verbally abusive, and
Wow.
you know, I was able to make the connection between encounters with mom or other kinds of interactions with mom and her attacks. And once she saw the connection, again, you know, as you were saying earlier, when people have these repressed emotions and they're to the point where they're not even aware of them. I mean, it's incredible to think that you could be so physically ill you're in the hospital because of an emotion that you're not aware of. You would think you would have an inkling about it. But once we were able to bring this into her conscious awareness, she said, "Oh, you know," she had this light bulb moment. I still remember her looking up at the ceiling and saying, "Oh my God, I can't believe it." And in her case, you know, I wish I could cure everybody like that, but you know, at the other, you know, end of the spectrum, there are people who need to come and see you for, you know, 5 or 6 years of therapy before they achieve the same outcome. But in this woman's case, just making that connection, she could see it, she could use her very good cognitive skills to work on it. I urged her to see a therapist. I don't know if she ever did, but she called me a year later, went the whole year with no attacks.
Wow. Well, yeah. Okay. Thank you for sharing. Because to me, because there's so many pieces in that, right? Like in terms of just the confusion inside, you know, almost like pushes more terror of like, I guess I made the face when you said about when she said, "Don't even try," because it's like this hopelessness and this exhaustion and this helplessness of like, everyone's looking at me like I'm a problem, which I think.
Like they're crazy. Yeah, like they must be, you know, psychotic or something, which is, you know, not the case. My patients, you know, on the average, I think they're psychologically stronger than the average person because they've been through trauma, abuse, you know, all kinds of difficulties. I think of them as heroic for what they have endured and overcome. So they're the opposite of crazy. They're mentally very strong. And once they figure these things out, once they see the underlying issues, they've still got all of that strength to bring to the world.
Yes. I think that there's a few pieces. There's number one, there's like this non-pathologizing, right? Somebody just wrote, "That's why they trust you." There's this non-pathologizing energy where, right, where we convey, or if you have the knowledge, right, sounds like you conveyed to this client or to this patient, where it's like, well, let's get curious. And then there's obviously this incredible skill that you had to kind of do this assessment and kind of look at the things creatively. And she had enough, you know, capacity to, right, because not everybody has that cognitive skill or the capacity to link it up, or it takes some more time. But it sounds like just by the brain linking up that confusion to the facts, settled her entire system, which is huge, which, sometimes people say, when will I get better? And sometimes I say, like, look, it could be within a few sessions that there's like a huge sense of relief just because things are starting to make sense. So you're not living in a world that seems confusing and that your body just seems like it's speaking a whole different language. So I think that's amazing, like that work. I think with clients, just to name to the fact, some people it takes a little while. Like obviously there's some people who have chronic conditions, and it could be for someone like that, maybe like around holiday times, because I know like the Jewish holidays are coming up, and then even Thanksgiving or whatever comes up. Sometimes even the brain and the body knowing, okay, it makes sense. I'm going to have some symptoms now, or yeah, that makes sense. I'm feeling like almost the normalization and having this inner voice of self-soothing or reassurance, right? Versus like, oh no, I'm losing it again, or I'm nuts again, or, can help. And then sometimes I guess like actually engaging and healing the trauma, sometimes what we see, and you probably have seen this too, but if somebody was trapped in a sexual abuse situation, or if there's something else, that comes up, I think that, sometimes what we've seen from the somatic stance is that the body kind of gets trapped, right? Like the emotions or the sensations get trapped in the body. So I've seen people with like non-epileptic seizures, or I've seen people with
Oh yeah.
right, the conversion disorder, right? And so it's kind of, and maybe you could talk a little bit about that, where the body is literally talking to us. And if a medical practitioner doesn't understand it, they just think this person's crazy. But it's like, no, the body is actually literally going back in time or taking on this survival stance, right? So I don't know if you want to share about that or what.
Yeah, no, that absolutely can happen. And one of the techniques that has helped a lot of my patients is that I ask them to imagine a child that they care about, either their own child or somebody else's, and imagine that child growing up exactly as they did. And imagine themselves, for example, that they're a butterfly on the wall of their childhood home, and they're watching their own child try to cope with that same environment, even just for a week. And that can really help break through a lot of repression. It can really help connect people with emotions that have been repressed that they may not be consciously aware of. Because when they look back at their own life, they're maybe saying, well, things weren't that bad. I got through it. Other people have been through worse than me, and they seem to be okay. But as soon as they start thinking about an innocent child having to cope with everything they did, then they get a completely different perspective.
Yeah, I love that. One of my consultants, I think, used to call it like, if the client's really blocked, can you just take them to a completely different country? Just say, like, imagine you're in Italy. You're walking down the street, you're with one of your friends, you're fully grown up, right? Make sure we have that dual awareness of the adult them, and say, like, and then you pass by a house and you hear a child screaming, or you look through the window and you see a child being ignored for 10 hours, right? How do you feel towards a child? So exactly what you're saying, like pull it out of your narrative, pull it out of, like, it gets all blended, right? Um, Sometimes, just to name, so for some people they naturally can go there, right? And they have that like comfort and that nurturing capacity. For some people, I just want to name this so people don't feel judged if they don't have that capacity. Sometimes people develop something called like phobic avoidance, which means where they have a phobia of their inner emotions, right? And they end up like avoiding, or even when they see like vulnerable children or people that are being hurt, they kind of like pull away or they feel disgust. That's usually just because that's how they were treated, and they have a hard time offering that compassion. If that's you, that doesn't mean that you're not healable. It just means that part of the treatment would be being able to work through that defense of having that like reaction to vulnerability. It can, over time, with the good help of a therapist or a good doctor, whoever, shift that over, right? Many times with the good help of another person, you borrow that nurture, learn to develop a more nourishing voice with compassion to that inner child or that inner part of you that experienced that wounding, and then even develop passion to the rage or the anger or the sadness or the trauma memory can help shift things. So I just kind of want to name that, because sometimes
Yes.
people have that complexity, and I always just say, like, please don't judge yourself if you don't have that natural like maternal instinct or protective instinct. Like, if you don't, it means you have to protect yourself so strongly against any criticism or the way people around you acted, or to or with you. um,
Yeah, and I've had people who've gone through that exercise, of thinking about a child trying to cope with what they did. Even just thinking about it, that child coping for a week or so is enough for a lot of people to get, very emotional, very connected with the emotions they have. And then they can follow that up by doing some writing, which could be, writing a letter of comfort to that child that they're watching try to cope with this. Or it could be a letter where some stronger negative emotions are expressed, a letter that's not mailed to the parents, to the perpetrators of the adversity, and to just put down all their thoughts and feelings, both good and bad, about that person or those persons. And the more people can express these emotions in words, usually written, sometimes spoken to a therapist, the less those emotions need to go into their bodies and cause symptoms.
I love that. Can I just repeat what you shared? So two really powerful things, but one is Ema, we're going to post again at the end the names of the book, and we'll mention it. I'll put it in the notes so you'll know exactly how to find the two names of the books. I just want to repeat this. That was very important for those listening and those who are going to be listening. So one is being able to help the person struggling with symptoms, right, and conditions, be able to see that child or that person, right, even if it was an adult self or a teenage self in that situation, and see how someone, how to cope in that situation, right, to see almost like an objective
Yeah.
person. And then what you're talking about is two really powerful things to get in touch with the emotions and the sensations and the experience of that person, right, their younger self going through it. So one is, like you're saying, writing a letter to validate or to speak to that part. Is that what you're saying? Like speaking to the pain or the burden? So it's kind of like, yeah,
Yeah,
tell me.
well, writing a letter to the child that you have just watched to try to cope with your own early environment, to try to, which is obviously your inner child, and trying to give that uh, child some comfort and advice and soothing from an adult perspective. Because then
Yeah.
you're really giving it to yourself, obviously, and you're doing it from an adult perspective, and it makes a big difference. One of my patients, I'll always remember, had grown up in a situation where she was the only child and the parents were constantly fighting, and she was the peacemaker. Parents divorced when she was 8 years old, but they kept living in the same household. They started sleeping in separate bedrooms, obviously, after they got divorced, but they were still living in the same household, and they were still, fighting with each other. And so, nothing changed. But the patient, who was, very high IQ, very verbally skilled, worked in a very, intellectually demanding profession. But she was using her intellectual cognitive skills to keep all the emotions from that era suppressed. And she was telling me over and over again that this really didn't bother her. She coped with it, that every other people have been through worse than that, and they seem to be all right. And so I finally asked her, what would it be like if you were a butterfly on the wall of that home, and your niece, she had a beloved niece, that was, I don't know, 4, 5, 6 years old, and your niece was suddenly in that environment with your parents, and you had to watch her try to cope with your parents for a week or so. What would that be like for you? And she just stopped talking. I mean, she was somebody who could, carry on a
Yeah.
conversation endlessly, and she just stared at me for, what for her was a long time, and finally said, at the end of the week of watching that, I would shoot myself.
Yes.
So
Yes.
finally made the connection, and that just turned everything around from her. A lot of my patients, they've grown up in situations where what they're used to is, demanding, narcissistic, randomly violent types of situations. They end up in relationships with people that are not so good. Let's put it that way. I would refer to them generically as bad partners. And she was in one of those. In fact, she had been in one of those relationships every 18 months for the previous 20 years.
Oh.
But after this experience of that, saying I would shoot myself if I had to watch my niece cope with my parents for a week, she dumped her boyfriend the next day. She was single for vastly longer than she'd ever been single before while she was processing all of this, and finally met the love of her life. And they've been happily married for, I don't know, must be close to 10 years now.
Oh, okay. I want to just repeat back what you're saying for those who are, so just want to explain the scientific piece, right? So this is incredible. I love what you were saying. So it's kind of like speaking to the child And I love the butterfly or the fly on the wall concept. So it's kind of like seeing that, and imagine a child that you know going through that, right? Or a child. So there's like this nourishing part that's seeing that. And then by being able to feel the feelings of protection or anger or not okayness, right? I would shoot myself kind of reaction is basically allowing the person to realize the not okayness of that reality because she was
Yep.
about that. So there's that rage and there's the like, no. And then because she was suppressing that before, she was unconsciously repeating, obviously being in unhealthy relationships with really unwell partners, being able to own that and start making sense of that unconsciously, bring it to consciousness, she kind of became healthier, was able to be more okay on her own, and then bring a healthy partner in her life.
It's one of the great things about this work, Esther, is that by alleviating people's pain, you also, change their lives in positive ways. It's I don't think of it as a side effect. They're integrated with each other, but it's
Yeah,
it's great to see it. Another
yeah,
one of my patients had been married to two of our cardiologists, and they both of those relationships ended, and she wasn't even looking for a relationship, but she had done this work. She had alleviated her physical symptoms. She was a different person. She was just going to her car in the parking lot after she'd finished her shift at the hospital. She was one of our nurses, and she just started chatting with a guy whose car happened to be parked very close to hers. And that was it. He was the guy. And they're now happily married for, it must be 15 years or so. It changes people's relationship with the world as well as with themselves.
yes. So I love how you're saying that. Well, first of all, there was a second point I forgot to recap, but it was kind of like the writing a letter or the kind of like seeing that from the child, writing something to the child in that pain. And you wrote the other thing, which I thought was really powerful, which is writing to the person who hurt you, right?
Yes.
Child. So like the rage and the anger and the responsibility, because a lot of times when somebody perpetrates or neglects, the burden gets put on the child, and the healing happens when it's like, it doesn't belong to me, like I'm giving this back to you, or you're like all that anger, or so kind of both of those two activities. I just want to name that so we don't have to send it to that person. Many times it's not recommended, but
No, I recommend people typically don't mail them because it turns out it doesn't really end up being constructive. I have had a few people have mailed them, but the results have been generally disappointing.
right, because usually when somebody's healing, the people who hurt them, if the people who hurt them have done their own accountability in healing, they would say, I'm so sorry. And if they haven't said, I'm so sorry for the horrible things I've done, they usually don't have that capacity, and you don't want to go back to that. You want to move on and ahead. But about this woman you mentioned, I love how you're saying that, is like when we unburden our internal systems, or when we, tend to shift internally. I love how you're saying that there's always this parallel process, right? So unconsciously she was able to maybe, right, like lessen that pain and open more joy and open heartedness and just open to a new person or a different kind of relationship. People sometimes say, how do I do it, how do I do it, how do I do it? And on the one hand, sometimes like we could feel compelled to give them advice, and what I often find magical, though of course sometimes there's skills for relationships and things like that, so much of what you're talking about is like when we do our own internal healing, like what you just said, is like we change the way we are internally, but so much we also change to the world and the way we experience the world and how people on the world experience us, right? And
Yeah,
that's
it's so true. A lot of people, once they fully recognize the magnitude of what they endured as kids, what they had to overcome, they can see that experience, instead of taking blame for it, instead of feeling like a second-rate human being, they can look at it as though they were born in the far side of a dangerous mountain, through no fault of their own, obviously. They just happen to be born in this very difficult place, but they can take tremendous credit for having climbed up and over that mountain to get to be an adult. They can recognize their own courageous perseverance in what it took to endure those experiences, and make it through. And once people start thinking of themselves as heroic instead of as second rate, it changes everything. Their ability to take time for their own personal joy, their ability to set boundaries around toxic people, their ability to be in relationships where they insist on mutual support in that relationship. All of these things change. And part of my therapeutic work is to help people with that journey from feeling like second-rate individuals, feeling like, low self-esteem that they typically start out with, to thinking of themselves as heroic survivors.
I love that, right? Because internally, like the beliefs, right? I guess I think in terms of like the different kinds of methods we use at our practice, like when we're shifting that internal belief, the way we carry ourselves is different, the way we feel stress, what we tolerate, and where we set boundaries, all of that is impacted, right? Because you talk about building the self-esteem as we build a sense of self and like, right, noticing that you're a hero and you were slaying dragons all your you're so
Yes.
incredible. And nobody told you that, but of course you were. And in this space together, right? We're going to acknowledge that like, oh, whoa, right? And then if you've been slaying dragons and somebody talks to you disrespectfully, then what would you do or say? Right? You're not just like, oh, sure, I'm going to take these crumbs. So I love how you're, speaking about this. I wonder if there's something that you can say to anyone listening right here, right now, or that's struggling with some stress-related pain or some memories that they notice that's coming up for them or sensations. Yeah. What
Yeah,
would
I'm a big advocate of writing exercises. When people are listening to our discussion here, they're going to perhaps be thinking about the past. Some of the adversities that people have suffered are fairly subtle, and it could be a conversation like ours today that enables people to understand those issues more clearly. And if you can sit down and do some writing about them, doesn't have to be grammatical, doesn't have to be spelled correctly, just write whatever comes to mind. Writing has a magical ability to pull thoughts and emotions out of people's heads that they didn't necessarily know were there. And if people do that, they may get some insights that they wouldn't get otherwise, that'll help them move along in the healing pathway.
Yeah. Kind of just take out a pen and paper or crayon on paper and kind of just allow yourself without being careful of your spelling, just to kind of allow whatever's bubbling up to come up.
Yeah, I would also mention this is the 21st century after all, and there's an app out there called Curable that a lot of my colleagues and myself and also have contributed to, and it's got a lot of exercises in it that are sort of individualized for the person who's using it, and I would recommend that as well as it's kind of somewhere in between a good book and a good therapist in terms of the resources it provides.
You are curable. You are curable.
That's it.
Yeah, and your symptoms are curable. And one of the big things that I think is important for people to know is like, because sometimes like we have a conversation like this, and it could sound so simple, but I just want to name the fact that I can appreciate that anyone listening or any of us, right? Like when life, we go through a blend of like pain and pleasure and joy and confusion, and it's always a mix. It's not just like, oh, you had a horrible childhood and now you have an amazing life, or, things. I just want to name the fact that at different times in our life, we might have different struggles. And so if you have something coming up from the past, or maybe you didn't know that you had things in the past, we'll have stuff, some big, some small. And maybe there's something stressful going on right now. Like maybe your marriage or your relationship is not where it needs to be, or you're feeling stuck, or you're feeling stagnant, or you have this critical voice in your head, or you self-neglect and you go to sleep, or you're not taking care of your body, and any kinds of things, right? Like any kinds of behaviors. I just want to name like these things that we're talking about are helpful to you. Even just taking a pen and paper out and like processing or sharing what your mind and what your body might be needing or might want to share. Just, I think some of it is about like learning to listen to what your body is saying, right? And start
Yeah,
from there.
yeah, no, absolutely. And you're reminding me that people can have a lot of coping behaviors that are, looked on as dysfunctional. Many of my patients have, for example, had eating disorders or cutting behavior or any of a variety of addictions, which not only to substances, but, to behaviors like gambling or working or sex or even exercise, shopping, I have seen. And those all are simply coping mechanisms for the emotional turmoil associated with all this. I don't think people should look at those as an aspect of a character defect or a disease. They're simply ways of coping. And when we can get at the underlying causes, the same causes that lead to physical symptoms, whether pain or non-pain symptoms, when we can address those, a lot of these coping behaviors are not needed as much anymore or at all. So that's another sort of fringe benefit of doing this work.
I love that you say that because it's interesting. I started off working with a specialization in substance abuse with people who are struggling with addiction. And then I realized very soon after, like, we're teaching them to stop the behavior. And I'm not saying every drug treatment center is only about the behavior, but the focus was primarily on shifting the behavior. And I would get people to be sober, or I would coach them on it. And then they felt all this shame or this horror or this rage or this anger. And they were like, well, what should I do with it? So essentially, the addiction was just a way to tend to and to soothe. It was the only way they knew how, the pain. So the work was about, like, could we actually help you connect the pain and tend to healing the pain or processing the pain or the emotions or the anger or whatever it is, so that your body doesn't have to go back to these unhealthy coping. And I love how you're saying that, because it's less pathologizing of like, oh, that person's an addict, to oh, that person is actually surviving in the best way they know how. It's not good for them in the long run. I'm sure they know that, right? Or we can help
Right.
them.
Of course they do. Yes. Yeah, I couldn't agree more. Yeah, and it's the same I found, at least in my practice, with people with eating disorders. They are typically in a state of emotional chaos, and the eating disorder gives them a measure of control. They can control their body, and it's sort of a lifeline to hang on to while they're trying to cope with the turmoil elsewhere in their life. And by addressing the source of the turmoil, the need for the eating disorder becomes less. Treatment programs that just focus on body size or weight, or trying to convince people they're not too thin, that they're too thin, you're not going after the real source of the problem in those patients.
Yeah. It's like perpetuating that disconnect between the intellect and the body. And it's like, I could force you to eat, or I could try to push you. And it's like, again, I'm telling you to divorce yourself from what your body is really saying or what your mind is holding. So yeah, I always say, I'm like, look, sometimes it's really important to have that behavioral piece, like with people who struggle with, right, these addictive behaviors or the disordered eating. I think there's a piece in terms of keeping them healthy. But I know just last week at our practice, we were talking about the concept of emotional hunger. I know lots of people, but lots of people with some of the disordered eating in terms of bulimia, or in terms of anorexia, or just obviously the spectrum, of like the concept of like, how did they learn what it means to be satiated, the concept of touch, the concept of love, the concept of to be filled up. And I don't mean by food, right? And then even
Right.
sexual piece, like people are looking for intimacy and connection. If they're going to sex addiction, there's like this starvation for intimacy or connection, but essentially if it's not connected in a healthy way, they end up feeling empty and hollow. So it's about really tending to working with those child parts, or the parts that have to learn that muscle or re-experience what does that mean to feel touched or to feel loved or to feel cared for in a way that's like healthy. So we're working from the inside out.
Yeah, and to feel like you're worthy of that, to feel like you are worthy of being in a relationship where it's mutually supportive, rather than in a relationship where you are giving 95% to the other person and only getting 5% back. You have to get to a place of, I deserve this kind of person. It's, actually some of my patients have developed their symptoms after they have first been in one of those relationships, a mutually supportive, giving relationship, often for the first time in their lives. And that's when their symptoms strike. And the reason for that, there are two reasons for that. One is there's an element oftentimes of imposter syndrome, where they feel like they're really not worthy of this person they're in a relationship with, and this other person is going to figure that out and is going to dump them because of that. So there's anxiety around that. But the other reason is that if they decide, well, maybe I am worthy of this excellent relationship that I'm in, that everything is going great in my life, maybe I really do deserve this, maybe I really am a good person. But if that's true, then all of this stuff that I went through when I was a kid, I did not deserve. And then the anger gets stirred up by that. But it's anger that they don't have any experience coping with, so it manifests as a physical symptom. I've seen this so often, I call it the good partner, bad illness syndrome, because,
I love that.
people tell me, my life is going better than ever. I can't possibly have a stress-related illness. And that's true unless you went through adversity as a child that you haven't processed yet.
Okay, so I just want to name that because someone posted about this before. So many times people reach out and they're like, my life is better than it ever was. And
Yep,
I'm so uncomfortable. I am so anxious and I'm so on edge. And I love how you just named this, right? It's number one, it might be this imposter syndrome of like, oh my God, they're going to figure out I'm from the dark side or I don't belong here,
that's right.
right? And then the other piece, and like even teaching the body positive affect of how do you even stay present in just the being, right? An experience. And kind of like, I love how you said that it's that core belief of like, so are there parts of you or can we help your internal really learn a new belief? Or a belief that really belongs to you that you are deserving, right? This world is not just meant to be about suffering. And the other piece that you mentioned, which I love, is when you have light, you start realizing darkness. So suddenly, when you're stable, and it's the same thing with dissociated memory, right? When people are stable or things are good, lots of times, right, dissociated memory or whatever emotions of the past get highlighted because they're stable enough, and the body is like, "Hi, remember me? I want you to bring me along. I want you to hear me." But it sounds like here you're talking about is like, wow, so then that was really horrible. And I can't believe I lived through that, right? So all that, retroactive rage or anger.
Yeah, and I didn't deserve it. It wasn't my fault, and that means somebody else did it to me, and that makes me really angry. But if you grew up developing your skills at suppressing anger, then you're not connected to those emotions. We've already talked about people who have enough negative emotion that it's making them physically ill, and they're not consciously aware of it.
Yeah. Yeah. So it's almost like I just want to name to anyone who's out there, like if your life is in a better space or if you have these things coming up, just know it's so normal. It's actually a sign of health. People who can make sense of this and can be connected to someone who understands this, A, number one, health, and B, like anyone who can help understand you, whoever this person is listening, know that it's a sign of health and you can and you will move through it. You're not going to stay forever in this if you choose to, right? Like people can move through. The whole point is about listening to and allowing them to bubble up, surface, and move out of you instead of keeping repressing them. Because I always say, I'm like, it's like that game. In the arcades, they have these like alligators where you bop it and you bop one
Yeah,
up. So I'm always like, you're bopping it, it's coming back up. Like, let it come out. Like, it's really uncomfortable, but at least let it just like come up and out because it's going to soften each time. But yeah, a lot of times we're playing the bop it game.
yeah, whack-a-mole, or in the UK they call it splat the rat. Yeah, there's definitely an analogy there. But I assure people that, even though it seems like, oh no, they've got another mountain to climb, it's smaller than the mountain they've already climbed, and that they can, they've succeeded in the past to get themselves where they are today, and they can absolutely get through this mountain too.
I love how you're saying that, right? Because the body's almost like terrified or worried. Like, do I have to face this pain again?
Again, yeah, exactly.
Ah, yeah. And you're basically saying like the worst part is over. You're just needing to process now, like the fragments of memory or emotion that just needs to be processed and settled. But like the horrible part is not going to be relived, even though it's some of it up.
Yeah, I mean, you people who've gotten to this good place in their lives, they've gotten there because, they have energy and skill and persistence, and those qualities are going to carry them through this next phase, which is typically um, the last big one of the process. A lot of my patients, they've been slowly healing for years and years, and they kind of have done 90% of the healing they need to do. And when they get to that last bit, there's kind of a tornado that happens, and
Mm.
all of the last pieces of the puzzle kind of come together at once. And but if they recognize that, yeah, this is the last big chunk of work, it gives them encouragement.
I love that you're saying that, right? Because sometimes it's like it gets worse before it gets better, especially when you're kind of towards the end and you're like, it's this last chunk and it's the hardest one. And there's a lot of internal conflict of do you want to get better? Do you want to really heal this? Or are you afraid of it? Or all those stuff. But trusting in your strength and in your capacity to move and to process through it. So I love that. Somebody asked a question. I know we're wrapping up soon, but somebody asked the question, does everything need to be dug up? Are some things best left buried, or does everything need to be explored?
Oh gosh, that's a better question for you, Esther, than for me. Unfortunately, the nature of my practice was that I only saw patients once or twice, sometimes 3 times, so I had to find out as much about them as I could in a very short space of time. I didn't have the luxury of, weekly visits for as long
Yeah.
as the person needed. But I think that your relapse risk is lower the more of these issues you can address. There are people who have recovered from their physical symptoms, their pain or other symptoms, without digging up any of this stuff by using more behavioral techniques. There's a technique out there called pain reprocessing therapy that works a lot like this, using behavioral techniques to kind of reduce the fear level without necessarily digging up anything at all. But and that can work for some people. But what I've found through experience is that your chances for a relapse of the symptoms when life throws another curveball at you are lower if you can go back into the past and understand those emotions and put them into words.
Yeah, I love that you said that. I think that I would say something similar to what you're saying. I think if the person's asking the question, that means that they're aware that something is buried. So I usually say this: we don't go digging. Not in counseling, we don't go digging. If you're landing up in our office, or if you're reaching out, or if your child's bringing up something, or your partner's bringing up something, or something's coming up in your head, then that means there's something that's bubbling. So I think the question to me speaks to the fact that maybe, and I'm not saying the person who wrote it, but I know lots of people ask it. So sometimes there's like awareness that things are buried, and then the question would be like, or the comment would just be like, wow, can we notice how amazing your system is that it buried some things? And you know what? Like, we don't go digging. The next question would be like, are there any symptoms, or is there anything that's bothering you? And is it okay if we tend to that while honoring the parts that are buried? In my clinical experience and professional experience, what I found is that if there's something important, it will bubble up and that will become, important. We don't ever just go, I understand why you did what you did. But like, to me, it's like a skilled practitioner therapeutically, when they're sitting with somebody, can read somatically, like on the body or even emotionally or relationally, hearing certain patterns. And there's a way to work with it and even work with what's maybe underneath the surface without like having and relive a nightmare. There's a way to kind of tap into the past for what needs to be tended to in a very gentle way, right? So I totally hear on the behavioral piece. I think sometimes behaviorally, like doing exposure work and helping the even just like lessen that level of terror or fear is tremendous. And that could be enough. It really depends on the functioning of the person. Like, some people have repressed memories that they never access. Do I think, like kind of what you said, do I think it's good? I mean, look, lots of people are walking around drinking way too much alcohol, always running away from their families, never being present. They have survival mechanisms and you won't know what they're running away from, or they avoid intimacy, or they have a difficult time speaking with their children, or whatever it is. So do we need to do digging? It's a matter of like, if you want to live wholesomely, if and when a symptom comes up or there's a blockage, it might do you justice to go speak to someone. And obviously, like a good, skillful person is going to do that in a way that's not re-traumatizing.
Yeah.
But sometimes going to the past or the core, obviously in a creative way, could essentially, like what you said, get to the root. So
And those buried issues, as you say, and I agree completely, will manifest themselves when the person is ready. And
yeah,
there's no need to push the process.
yeah,
One of my patients, I wanted her to write an unmailed letter to her dad, and she wasn't ready. It took her 18 months before she finally said, okay, I'll do it. But even then, she said, I'm only going to write 2 paragraphs, and only because you've been nudging me for 18 months. And so I said, well, I don't think 2 paragraphs is going to be enough, but go ahead. And it ended up, once she wrote the 2 paragraphs, she couldn't stop. And she ended up with, I think it was 9 single-space typewritten pages that she wrote to her dad. And it had, obviously a big catharsis, and her physical symptoms were 90% better after that. But she wasn't ready the first time she showed up in my office. And it took her a long time before she could finally do it.
yeah, yeah. Wow. This conversation has been so rich. I feel like it's such a gift from God that you responded to my email. I was so excited. Somebody had asked me information about you, and I was like, okay, this is like the 6th or 7th email people are asking about this blog. So clearly, and I told you I wrote your wrong initial. I wrote Dr. E instead of Dr. D, and she was like, I need references, and I was like, I'm just gonna reach out to him. And you responded. I was on the beach with my son, and I was like, ah. So Thank you for this. Can you just mention again the two books and the website
Yeah.
information for people who
Well, of
ask?
course, I had to respond. I mean, my parents are from Rockville Center and Garden City, respectively. So when I saw Cedarhurst, I had to definitely go for that. But yeah, the first book was They Can't Find Anything Wrong, and basically 4 dozen different case histories that illustrate the spectrum of different forms of stress that can cause illness. And the second book is the textbook for professionals, but science-oriented lay people can also get a lot out of it. And that one's called Psychophysiologic Disorders, and the nonprofit is the Psychophysiologic Disorders Association, which can be found at ppdassociation.org.
Amazing. And are you available for consultation, or are you not able to?
Actually, I closed my practice a number of years ago in order to teach full time, and I'm the director of the nonprofit. So I'm not really seeing patients at this point. I saw 7,000 plus patients, and I just decided that I could have more impact by teaching others how to do this work. So that's been very rewarding over the last 12 years. I've been all over North America and Europe teaching this material. And we've got, like I said, a big conference coming up at the end of October that people can sign up for via our website. We're going to have, 22 different experts who've been doing this, for an average of probably 20 years.
Amazing, amazing. Yeah, no, and I loved how I saw how you like on your website or wherever it was. What do you have, like stressillness.com? Is that your website?
That's my personal website. Yeah, it describes my book, and there's a blog on there as well.
Amazing. It's called stressillness.com.
Yeah.
And I got excited when I saw that you kind of, took your knowledge and you went to educate other medical professionals, just because there's such a big need. Jessica, thank you for writing the notes. This woman is so kind. She's writing everything down that you shared. So yeah, I just was so excited and grateful, because I think more doctors need to understand and offer that compassion and grace. And it's also really just refreshing to know that you're out there. So I want to thank you so much for your time. I want to thank those who are on here, and just hope that you can feel the wisdom from Dr. Clarke and the support, right? Seeing yourself as a hero, and tapping into your strength.
Thank you, Esther. It's been really a pleasure speaking with you. You obviously have a tremendous feel for these issues, and I appreciate that very much.
Yeah, thank you. Okay, take good care.
Thank you.
Bye.